the first thing I just wanted to cover real quick, just as a refresh of one of the questions that I did on Tuesday, was basically, for the sliding scale, you're going to look at the sliding scale. It's going to tell you to, it's going to give you the label. It's going to give you some information on what to administer given certain criteria. So it tells you, like, if the client's blood sugar was 315, then you're going to look for the range with 315, and then you're going to mark, or you're going to then order 8 units. You would administer 8 units, and then you would shade in the dose based off of those units. So if, like I said here, my answer here would be the 8 units. And again, we did this last time. So if you watch the previous recording, I am intentionally going through this again just to kind of rehash, because I'm going to show you another variation of this. Then you would go on to the syringe, and it says to shade the dose. So we're at 5, 6, 7, 8, and we would make a mark at the 8, and then we would just shade in the dose. Okay. And so that's how you would answer that question. Most commonly missed, at least or in some instances, what usually gets missed on these is you forgot to mark your syringe. So make sure you're marking the syringe, make it nice and clear. You'll be able to write better than I can with my mouse. You will also get a situation where you will need to mix 2 different types of insulin. So you'll see you have 12 units of regular and 16 units of U100. On your test, you'll probably see both labels listed. I just didn't have pictures of both to share at this point in time, but I wanted to give you some numbers, and then I'll tell you to shade the total dose. Sometimes some campuses will ask you to indicate which one you would draw up first, and then indicate the total. Just as a reminder, make sure you draw up your regular insulin first, then and obviously then you would mark your total. The thing that gets a little bit confusing, if you are marking for regular first, you basically want to represent the syringe as if it were in its final state, and then that the 2 insulins didn't mix in the process of drawing up. So like 12 plus 16 is 28. So our total would be 28. And then you would actually make a mark 28 minus 12 at the 16 mark. And that number, that range would actually be hypothetically where the regular insulin would reside. You guys are Boyce campus. I haven't seen a question like that. And my guess is that they're moving away from that at the Allegheny campus as well. Just because I think you guys probably know from a procedural standpoint to do 12 units regular first, and then you would go and pull in the 16 units, and then that's how you would prepare the injection. And so what I think they really want you to be able to do is, can you add, and then can you mark the syringe? So 12 plus 16 would be 28 units. We have a unit-based syringe. That's what that says here. It says unit, but the T got cut off. And what I'm going to do is I'm going to go to 25, 26, 27, 28, and I'm going to make a mark, and I'm going to shade the dose, which is the whole thing here. And I would just shade it in. If it told you to mark it, you'd mark it at 28, and I'd be very clear where you're marking it, so they don't think you're marking it at the 29. And then if they were to ask you to indicate regular, then there is a graphic demonstrating that on the OneDrive folder. So for 110 Boyce, we've pretty much covered all the various types of questions that you should or could potentially see on your test, which I know is coming up in a couple weeks. So I wanted to ask if you had any questions or anything that you wanted to see reviewed again. I'll just scroll up. You can type into the chat or you can unmute. And if you don't have any questions, I'll just work through a few more practice problems.
Hi, I didn't make it on Tuesday, so I'm not sure if you covered this or not, but I'm currently working on the dosage by weight, and it's the one where it might be like 80 milligrams per kilogram a day every 6 hours. Just breaking all that down sometimes gets confusing.
Sure. And to my knowledge, that won't be on the 110 test, but it's good because you're going to see it in the next couple of semesters. So we can certainly work through one. Was that an ATI question?
It was. So if it's not going to be on the test, I don't want to confuse anybody with it. You know what I mean? Yeah, that was just part of the ATI that we had to do.
Yeah, and the thing with the ATI is you're going to get a bunch of extra information that's important, but and you're going to see it throughout your nursing career, but you may not need to know it right now.
Okay.
And so what I'm doing is I'm going to try and pull up I want you to see like the types of questions you're going to see. And you have this blueprint. But if it's sometimes it's good to revisit it. You're just going to have household measurements, converting between systems, so metric and household, as well as metric to metric conversions. So that's like 8 questions. You're going to do intake, output calculations, mainly. It looks like your main thing is the intake. So you're going to get a list of foods that the patient receives at the hospital, and you're going to have to convert ounces to milliliters and then indicate the total volume that they brought in. You're going to do oral medication, one-step procedures. So that could include both tablet, capsule type medications, as well as oral suspensions, which would be in milliliters. And then the good news is the one-step subcutaneous intramuscular like questions, they're going to be exactly the same. Like you're going to do the exact same math as the oral med prep. So whether you're talking about an injectable or an oral suspension, you would still calculate milliliters the same way. And that's also important to know that if you see SC or IM, that automatically tells you that your dosage is going to be in milliliters. So you don't have to guess about that. If you see that it's an oral suspension and that the label says that it's available in some sort of, per milliliter, then you know that you're going to be giving them a liquid version in, and that your answer would be in milliliters. I did briefly discuss reconstitution labels last time because that's something that might be new. And then I think the insulin, that's what I just went over again, just mixing. Can you add them together and mark it on a syringe? Can you look at the sliding scale, know how to follow those orders, and then mark it on the syringe? But these reconstitution questions sometimes can be challenging. So let me see if I can pull up an example of one of those. But as far as the weight-based calculations, you won't see those on this test. You'll see them later on. All right, let me see. I know I have a example of this. At least I thought I had an example of this.
Dr. Rad?
Yes.
I had a quick question about the input output calculations.
Okay.
I just wanted to know, is ice cream and ice cubes gonna be included in that calculation?
I don't know that answer. You would need to double check with your instructor. I'm not entirely sure about that. The reason being is the only examples I've seen so far did not include ice cream or ice, but it did include Jello and popsicles, which I think everyone understands those are liquids, or you would calculate them the same way. So I don't know. I would ask your instructor what to be prepared for. That way, if you see it, then you know. So my guess is that ice cream is, it's just frozen milk. So that is a liquid, and ice cubes are a liquid. But I understand, like, what is it? Like if you have 4 ounces of ice, that's the equivalent of 2 ounces of water. Is that what you're taught?
I think so.
Okay, that's okay. That's what I'm saying.
Sorry, I'm not 100% sure. I was talking to somebody who's retaking 110, and they said there was some confusion on the test about that last semester, so I was just kind of trying to get ahead of it.
Okay. Yeah, unfortunately, I don't know off the top of my head to tell you better.
That's
So
okay.
I would just make sure you get that information like answered before, so you're not wondering about it.
Okay. All right.
And
Thank you.
if you find out, please email me and let me know so I can give, continue to give that proper information out. So you're welcome.
Thank you.
So we do have to memorize the intake output, like the actual ounces and cc's and everything for.
Yeah, absolutely. Yeah, you have to know all your basic unit conversions. You have to have memorized. Yes.
Well, that's fine. Will they give how many ounces they are though?
Yeah.
Okay.
You don't need to know that a Jello is like 2 ounces. Like it will say,
Okay, thank God.
like if you see on the practice, or obviously I'm not sharing this right now, but on the practice test that I put together for you guys, or the practice set, not practice test, you will see it's listed like this. So you'll see a quarter glass of orange juice, and then the question will tell you what a glass is. A glass is approximately 8 ounces. It'll tell you 6 ounces of coffee, a turkey sandwich, which isn't liquid, 2.5 ounces of Jello, a half pint of chocolate milk. So it'll tell you like what it is, not just they had orange juice, coffee, Jello, and chocolate milk, and then you have to guess how much they had of it. They're not, I don't think they're that cruel.
Got it. Yeah. Okay. So we do have to know pint as well. Okay.
Correct. Yeah, and
Got it.
I even added some practice. So pint, and I even put quart just in case. I don't think you're going to see that, but just in case.
Just in case. Yeah.
Yeah.
And it's always to ml.
And you're always making, yeah, because ml, everything in nursing and the medical sciences
metric
goes back to metric. You're right.
Got it. Okay. Thank you.
You're welcome. Yeah. And then something that also keep in mind. So like 1 cup is 8 ounces, is 240 milliliters. 2 cups is a pint, and 2 pints is a quart. So that number 2 is helpful for those household units. The question you might see, there might, it says that there's 2 questions for this, and this is what's called a reconstitution. And what this is a little bit different than the what you've seen if you've been practicing some of these questions, is that the label doesn't necessarily give you the information you need to solve. It's not as straightforward as it should be, or as it, and maybe as you'd like it to be. So I'm going to go over this real quick, and then you can see, and then I'm going to tell you how I would reduce this, and I'll give you, or I'll tell you what else you can do to learn from this and how to make up your own questions to kind of practice. So first of all, we have an order of Kefzol 550 milligrams IM. So if you don't know, because it says how much medication will the patient receive in one dose, if you don't know anything, the fact that it's intramuscular tells you it's milliliters. Also, you have a syringe, and that syringe also tells you milliliters. So the only reason I'm bringing this up is because this was a common theme when I did these reviews last semester, was students were getting hung up on what they were supposed to put as their units. And then I told them that just kind of, if it's an injectable, it's milliliters. Okay. I guess CCs is acceptable as well because it's a one-to-one relationship, but it looks like milliliters is the most appropriate answer. So it says, this is our order, 550 milligrams. This is how we're going to administer it intramuscular. And then you're going to do it every 6 hours, or the order is every 6 hours. Then we look at our label. The label says we have the Kefzol, but it says 1 gram. But I need to know how to get from milligrams to milliliters. And this just says 1 gram. So that's the other indication that you're dealing with what's called a reconstitution. So if you look at the label and it doesn't tell you the gram per milliliter or milligrams per milliliter, you need to look at the directions. And so what a reconstitution is it's a medication in a powdered form. I know you may already know this. This is just my way of just kind of reminding you if you ever get stuck on these problems. And you're adding sterile water to the powder, shaking it up, and then it's ready to be utilized. And then here you can see it's used for either intramuscular or intravenous use. So it tells you if we're doing intramuscular, which is what we are doing, you're going to add 2.5 milliliters of sterile water, and that's going to provide approximately 3 milliliters total. All that stuff really doesn't mean a whole lot. What is important is this right here, where it says 330 milligrams per milliliter. That's what you're going to use as your concentration, or what I would consider your available for this medication. And so the challenge with this type of question is just trying to figure out and where the information is. And you can see there's IV preparations, and the IV preparations might be a little bit different, but we're not doing IV. So just focus on the 330 milligrams per milliliter, and then you'll know what to do with it. So you can ignore the 1 gram. You can ignore what you're adding. You can ignore what the total volume is. What you care about is your approximate, or what they've established as your concentration of this medication. So for every milliliter, you're going to administer 330 milligrams. So once you know that, sometimes it's helpful. You want to make sure that the usual adult dosage is appropriate. This says 250 to a gram every 6 to 8 hours. We're within that range. So that means it's a safe dose or safe order. And then what I'm going to do is I'm just going to do my order over half. I'm going to take my 550 milligrams, and I apologize for my handwriting here, over 330 milligrams. Times my quantity, which is 1 milliliter. Then you take your calculator. $550 divided by 330, and you're going to get 1.666666 repeating. So you would just round that to 1.7 milliliters. So you're going to administer 1.7 milliliters. Then you're going to look at your syringe, and it tells you to shade the dose. One of the things you want to make sure is, are these in increments of 1/10, or are they by 2s? So I can say, okay, I'm at 1, then this would be 1.1, 1.2, 1.3, 1.4, 1.5, and then 1.6, 1.7 is what we want. So I'm going to shade at 1.7. You'll do better because you'll have this would be paper instead of trying to use a mouse. And then you would just shade the dose, just like you did with the insulin, insulin syringes. You're just going to shade the dose, and you'll shade it better than I am. This is just to show you what to do. So I want to show you just a few of these labels just so you can see what they look like. And then all I did was I did a Google image search for Reconstitution drug labels and just saw what they had. And then I'll show you some of the ones that I did. And I've also shared those images. It's in the OneDrive folder, so you have access to those. And also you should know that even though there's like an Allegheny folder and a Boyce folder, you can go into the Allegheny folder for some practice, some additional practice should you need it. So don't feel like you can't go in there. So let me pull up those images just because I want to show you what those look like. So I think they can be helpful. And I was doing this last time that we got together too, but this will just be something new. All right. So what we're looking at here is ampicillin. And I think I can rotate it. There we go. And you'll see, so it'll be some order. Let's just say it's 500 milligrams ampicillin. And then it says, how much would you administer, for a dose? And then to mark your syringe. So this is a good indication that we're dealing with we're definitely dealing with a reconstitution problem, because it tells you 1 gram, and then it also tells you intramuscular IV use. So the thing that we're missing is, the milliliters. That's what we gotta figure out and look for. Now, my guess is they won't do this to you like on a test where you have to kind of rotate your screen and everything like that. But if you needed to, you can, and I'll do that. Just turn your paper. But let me rotate this again back to its original position. We'll zoom in. So really, I don't care for, at least when it comes to the reconstitution problems, I don't really care what's on the main label. I need to go to the side label that tells me my directions. So if I have an intramuscular injection, which is most likely what you're going to be dealing with, it tells you to add 3.5 milliliters of diluent. But remember, I told you before, we don't really need to worry about that. What we're looking for is, it'll say something like resulting solution contains 250 milligrams of ampicillin per milliliter. That's what you're looking for. So if this were a 500 milligram order, then you would be giving them 2 milliliters, and then you would mark 2 milliliters on your syringe. And then it'll tell you the usual dosage range, 250 to 500 milligrams IM every 6 hours. The only reason that's important is, and you'll find that when you get into 3rd semester and you're doing pediatric dosages, it's important to make sure it's within a safe range, and then that it's a usual type of drug administration. You don't want it to be unusual, when you're kind of double checking to make sure it's safe to administer. So if this were to say like 750 milligrams every 2 hours, that might raise a red flag, and that might be something you'd want to confirm with the referring physician, because maybe it was an error, or maybe that's exactly what they want to do, and they're doing, essentially an off-label dosage, which I'm assuming that's fine within the confines of what knowledge they know about that particular medication. Another example. Maybe I need to. Oh, there we go. So here's tazidime. It says 500 milligrams. We know it's an injection. So if it's an injection, it needs to be in milliliters. So the 500 milligrams is not telling me how many milliliters to administer. And so we're going to look at the label. Okay. So the label tells us a couple of things. It says to dilute with at least 5 milliliters of sterile water, shake well. For an IM solution, you're only going to actually add 1.5 milliliters. And that is going to give you an approximate volume of 1.8 milliliters. But what we're looking for is the concentration, the 280 milligrams per milliliter. Then it'll tell you some other details, but we don't really need to worry about that, at least not for math purposes. We just need to look for the concentration. So if you're seeing what I'm doing here, I ignore what they're doing to get to this concentration. I just want to know what is the concentration. And that's what you want to know. What is the concentration? Another example. This was probably a better example of what you'll probably see on your test because everything's in the same plane. So you don't have to go looking for anything. And then most likely it's going to be an intramuscular application. And you can see it says to add 2 milliliters, use promptly, and each 2.6 milliliters of solution will contain 1 gram. So this is a little bit of a different situation because it doesn't outright give us the grams or milligrams per milliliter, but it does tell us that for each 2.6 milliliters, it's 1 gram of the medication. So if I'm writing that down, I'm going to say 1 gram per 2.6 milliliters. So you want to make sure, especially for this one, this is why I pulled this one out and continue to use it, is because it can be challenging to find. And you might be looking for what says 1 gram. Is that 1 gram per milliliter? Is that 1 gram per what? It's 1 gram per 2.6 milliliters. So don't, like I said, don't get too hung up on, what you're adding. Just look for what the totals are if it doesn't give you the exact example of, like we were seeing in the previous ones. So let me see if I have another question here we can pull up. And I'll let you look at these. I'm not going to pull all these up. I just wanted to show like a different one. Like sometimes you'll see, it'll be a solution. And it'll tell you, the vial either has 500 milligrams or 1,000 milligrams. And if you're going to dilute it, you're either going to dilute it by 10 or 20. And then this is for acyclovir. And basically, you're still going to get the same concentration. So 500 over 10, it's going to give you the same milligrams per milliliter as 1,000 over 20. So 500 over 10 would give you 50 milligrams per milliliter. So regardless of which vial you use, you're going to be administering 50 milligrams per milliliter. And then there's a Pfizer pen question that I'm looking for. I think it's this one. And of course, this is the one that doesn't rotate. Capsol, you can see, oh, here we go. Here's the Pfizer pen alternative that I was looking for. Why can't I rotate that? It's okay. All right. Yeah, so this is just when we did Capsol 1 gram, this is a 500 milligram version of it. But the Pfizer pen, this is a little bit interesting. And for some reason, it's not going to let me rotate the image. Let's see. Yeah, it's not letting me rotate it. Okay. So that's okay. But on the side here, it'll tell you add, and it'll give you different concentrations or different volumes of sterile water to add. And then it'll say to get to, these are the units per milliliter of solution. So a lot of times you might see the question that says like, choose the strongest concentration and administer whatever it tells you to administer. if you see something like that, and I know this is hard to see, so I apologize. They said the it's not letting me rotate the image. Yeah, and I don't want to. I guess I can here. Let's see. I don't even know if that's helpful. Okay, that's okay. Anyways, so you would look at your list of available solutions. So you have 50,000 units per milliliter all the way up to 500,000 units per milliliter. If it asked you to use the strongest concentration, you would use the 500,000 units per milliliter. If it asked you to use the weakest concentration or the least concentrated, that would be the 50,000 units per milliliter. But in this situation, or in this particular label, it tells you specifically the units per milliliter. So you do not need to worry about what they added to get to it. So you don't need to worry about this. You just need to worry about which one of these to use. But my guess is you're not going to get this type of question. You're going to get another version of the reconstitution questions. All right. So are there any questions that you might have? If you've been looking at any of these questions, anything that that you'd like to see worked through again, or and even if you have ATI questions, those are good questions to kind of go over as well.
Will there be any drop examples?
You won't have drops on this test, like drop factor questions. You won't have that on this test.
Okay.
Good question. Yeah, I know, like with ATI, you're getting kind of like a hodgepodge of things, but you won't see that on this test.
You said that the test is going to be paper, not online, not like on a computer.
I actually don't know that. My guess is that because you're back on campus, it will be paper, but I'm not sure about that.
Okay.
It's a good question. It's helpful if I know these things, right? But I don't know, just because I just do the reviews. So I'm not sure how it's administered. I would just be prepared either way. But my guess is that it will be my guess is that it will be paper, because they want you to show your work and everything like that.
Are we going to have like multi-level conversions for weight? So like mg kg day from pounds like to another unit. I did like math for health sciences and we had things like that, and I was wondering if we would have that yet.
Not yet. You'll get into like your weight-based calculations probably starting next semester. So second semester,
Okay.
definitely third and fourth semester, and then definitely during pediatric dosages.
Okay, sounds good. Thank you.
You're welcome. And then, oh, go ahead.
I'm sorry. Am I able to go back and watch this this Zoom over?
Yes, yeah, I post these all on YouTube for you to review, and then I've also been emailing the Zoom links to your instructor, but I usually post them on YouTube after we're done here.
Thank you.
You're welcome. And if you're not aware, if you're looking for, if you just do like a YouTube search, so if you do YouTube and then Dr. Rad, the Rad tutor, sorry, should just be Dr. Rad, the dork tutor, but that's okay. The Rad tutor, you'll find my picture. And then if you look through there's playlists that I put together. So I have a Boyce playlist, I have an Allegheny playlist, I have a Boyce 110 playlist, I have a general 110 playlist. So that way you can kind of see what is on there. I also have videos if you need a refresher for because I teach anatomy and physiology at Allegheny campus, and so I post some of my lectures on there as well, but I don't think you're going to need that.
I see the YouTube on there, so I'll just go on there. I think there is a link on here.
Okay, yes, yeah, that you should have a link there. Yes.
I'll go there. Thank you.
You're welcome. All right. Well, if there's no other questions, we can certainly stop there. If there's anything else that you want to look at, I'm happy to go over anything you want.
Guess we're good.
All right, sounds good.
All right. Well, thank you for your tutoring.
Yeah.
Appreciate it.
Thank you.
Yeah, absolutely. You're welcome. And I'll be here again for you guys Tuesday and Thursday next week. So if something comes up, just let me know.
How long are these videos? I tried to log on Tuesdays. I can like. How long are your videos?
So I'm usually here. Are you talking about what I've posted on YouTube or just like how long
When
are
you do
my
the Zoom.
sessions here?
When you do the sessions here.
So I usually will log, like I'm usually here from 2:30 to 3:30, but sometimes we'll end a little bit early.